Appendicitis, also called epityphlitis, is inflammation of the appendix. Appendicitis commonly presents with right iliac fossa, abdominal pain, nausea, vomiting, and decreased appetite. However, 1/3 to a half of persons do not have these typical signs and symptoms. Severe complications of a ruptured appendix include widespread, painful inflammation of the inner lining of the abdominal wall and sepsis. Appendicitis is caused by a blockage of the hollow portion of the appendix, most commonly by a calcified stone made of feces. However, inflamed lymphoid tissue from a viral infection, parasites, gallstone or tumors may also cause the blockage. This blockage leads to increased pressures within the appendix, decreased blood flow to the tissues of the appendix, and bacterial growth inside the appendix causing inflammation. The combination of inflammation, reduced blood flow to the appendix and distension of the appendix causes tissue injury and tissue death. If this process is left untreated, the appendix may burst, releasing bacteria into the abdominal cavity, leading to severe abdominal pain and increased complications. The diagnosis of appendicitis is largely based on the person's signs and symptoms. In cases where the diagnosis cannot be made based on the person's history and physical exam, close observation, radiographic imaging and laboratory tests can often be helpful. The two most common imaging tests used are ultrasound and computer tomography, CT scan. CT scan has been shown to be more accurate than ultrasound in detecting acute appendicitis. However, ultrasound may be preferred as the first imaging test in children and pregnant women because of the risks associated with radiation exposure from CT scans. The standard treatment for acute appendicitis is surgical removal of the appendix. This may be done by an open incision in the abdomen or through a few smaller incisions with the help of cameras. Surgery decreases the risk of side effects or death associated with rupture of the appendix.